Welcome to Quick MCAT Lessons, where I try to explain MCAT topics in 10 minutes or less. Today, we're diving into the structure and function of blood vessels. So, arteries are the largest blood vessels, of which the largest is the aorta. Arteries then branch into arterioles, which lead to capillaries that perfuse the tissues. The capillaries go into venules, which form veins, and venous blood empties into the superior and inferior vena cava, going into the right atrium. Let's just do a quick general structure of blood vessels. So all blood vessels are lined with endothelial cells. The endothelial cells help maintain the vessel by releasing chemicals that aid in vasodilation and vasoconstriction. They allow white blood cells to pass through the vessel wall and into tissues during an inflammatory response, and they release chemicals when damaged that are necessary for formation of blood clots. All blood vessels except capillaries have three general layers. They have the tunica intima, which is the inner layer. This is made of endothelial cells. You have a smooth surface for efficient blood flow. You have the tunica media, which is your middle layer. This is thickest in arteries, as arteries have much more smooth muscle than veins. Arterioles have some smooth muscle as they are thinner, and venules and capillaries have no smooth muscle. And the tunica media here controls vasoconstriction and vasodilation. Tunica externa is the outer layer, and this is made of connective tissue for support and protection. So arteries carry blood away from the heart. They're usually oxygenated, except for pulmonary and umbilical arteries. They have a thick tunica media, and they can withstand high pressure. There are also elastic arteries, like the aorta, which can stretch and recoil, and there are muscular arteries, like the femoral artery, which regulate flow via smooth muscle contraction. You have arterioles, which are small branches of arteries. They are the major site of resistance in circulation. They control blood flow to capillaries via smooth muscle tone. And just remember, arterioles are the primary regulators of TPR, and therefore blood pressure. Next, we have capillaries. Capillaries are the smallest blood vessels. They're composed of a single layer of endothelium cells. They are the site of gas, nutrient, and waste exchange, and their thin walls and small diameter optimize diffusion. There are three types of capillaries: continuous, which are most common and in tight junctions, like the muscle, skin, and central nervous system. You have fenestrated, which have pores for filtration, like in the kidneys and intestines. And you have sinusoidal. These have large gaps and allow passage of cells. This is found in the liver, spleen, and bone marrow. Finally, venules and veins. They carry blood toward the heart. They are usually deoxygenated except for the pulmonary and umbilical veins. They have thinner walls and lower pressure than the arteries. They also have a larger lumen and contain about 75% of our blood at a given time. Now, even though arterial blood volume is much lower, the total volume of blood passing through either side of the heart, which is the cardiac output, is the same. They also contain valves. They do this to prevent backflow, and this is especially prominent in limbs. And they need this because the blood pressure is so low that the blood would rush back down if you did not have these valves. They also rely on skeletal muscle contraction to help move blood, and once again because the blood pressure is so low. So just tying in some clinical relevance here, an aneurysm is a weakened arterial wall bulge. This happens especially in the aorta or brain arteries. Varicose veins is a valve failure in veins which leads to pooling. This is common in pregnant women due to compression of the inferior vena cava by the fetus. And there is shock. Shock is the loss of vascular tone or volume and can collapse arterial pressure. So just a quick recap. Arteries are thick walls, high pressure, deliver oxygenated blood. Arterioles are major resistance regulators. They control blood flow to capillaries. Capillaries are single-layer exchange vessels, and veins are thin walls, low pressure, and they return deoxygenated blood. They also use valves and muscle pumps. That's it for today. In the next one, we'll talk about the composition of blood, including red and white blood cells, plasma, and platelets.